You could really debate whether or not there should be any new treatments for follicular lymphoma because the vast majority of patients do very well, and I recognize that. However, I think patients are always interested in a treatment that is very effective and also well tolerated. And from my standpoint, trying to augment chemotherapy is not really that attractive. So this is a true immune therapy or a therapy that is focused on why follicular lymphoma is follicular lymphoma. So rationally, it just makes a little bit more sense. And it appears, though not randomized fashion, that this is a very well tolerated therapy that should challenge chemotherapy. Now, who's going to do that study and what should it look like? I think that's still debatable, but I really do think if we can optimize the duration of treatment, and we have some correlative studies in cell-free tumor DNA that might help in that regard, and then move it into a trial, and if, again, multi-center, if you can see these results hold up, then it really should go head-to-head with chemotherapy in frontline follicular. In my personal opinion, if you have someone that you have no concern about transformed disease, absolutely. Why not try something that's highly effective? And again, if you're seeing such high PFS at 2 years, to me, that's very promising. So yes, absolutely, I have zero reservation that this should replace chemotherapy. Now, there are patients where that may not be true, and those that have high LDH or have clinical symptoms that suggest they might have concomitant large cell lymphoma, it's probably not appropriate to replace your anthracycline-based approach. This patient population was actually younger than your average patient population, so our median age was 58. Now, we did have a range of 33 to 84, so we do get all aspects of that spectrum. We haven't looked at the data or the outcomes in terms of young versus older patients. In my personal experience, I think as long as creatinine clearance is adequate, older patients can tolerate this just as well as the younger patients can. Though again, I think the questions remain, what is the optimal dosing and duration? So almost all of these patients only had 6 months of the 20 milligrams of lenalidomide because they all rolled down to 10 after 6 months. So again, I think if you can optimize the dosing and the duration, then this should be applicable to any patient population.